Hi, guys. This is Ohio nursing home abuse lawyer Will Eadie, here to talk with you about 5 ways to get your parents moving in a nursing home, which we all know getting around, getting up, and getting moving is such an important part of our health. So, number 1, think about seeking out therapy orders. Now, what do I mean by that? Well, it's normal if someone gets sick and they're hospitalized that a physician might put on an order for physical therapy. If there's problems cognitively, there might be speech therapy or occupational therapy, but those are generally limited in duration and they're tied to an injury. If you see a loved one with a decline in a nursing home setting, it's important for you to seek consultation with the primary care physician, the nurse practitioner who's involved, and say, I see this decline. Here's what I'm seeing specifically. I think therapy would be beneficial. Can you put on an order for therapy? If you have a primary care physician or nurse practitioner that you trust and like at the facility, that's great. If you find that you've been assigned one, or your parent or loved one has been assigned a physician or nurse practitioner that doesn't seem to be taking much of an investment in your loved one, you can always seek out a different primary care physician. That is not something you don't have to accept whatever physician or nurse practitioner works with the nursing home generally. Number 2, go ahead and meet those therapists if your schedule permits and attend those therapy sessions. Watch what happens, ask questions about why they're doing what they're doing, how they're doing what they're doing safely, learn, and if you can, get some of the basic equipment, okay? There's therapy bands, you might be allowed to use the hand crank wheels, things like that. Even just how to safely help someone get up into a standing position for safe physical activity for them. Find out what's safe for them, what you can do safely. And then number 3, go ahead and try some of those therapy techniques. Work on what's safe for you to be involved with. Obviously, there's some things therapists do. They're trained professionals. They tend to be some of the best care providers in the facility, or at least are able to give the best care because they're not understaffed like nurses and nursing aides, unfortunately, often are in nursing home settings. So they have more direct time for focus on somebody. So they're able to do things that you're not going to be able to do safely. And you obviously don't want to push somebody beyond what's safe and lead to injury, but try those safe activities. Get them up into a chair or a safe standing position if they're able to do that, doing some of those movements and activities that they do in therapy to try to keep that going. Just like when we're younger and we're able to move on our own a lot better, if we hurt ourselves and go to therapy, they'll tell you, go do this at home. Here's your home therapy session. And the therapist might be able to weigh in on that as well as to exactly what's safe, what equipment you use. Number 4, help your parent or loved one engage in all the safe activities that the nursing home puts on, and whatever activities they might enjoy that you're able to do with them. So for example, a lot of nursing homes will have, sitter size where, if you have to stay in a wheelchair, you're able to move your upper body or even lift your legs up and do those kinds of exercise activities. They'll have bingo, trivia, music listening, any activity that your loved one can go to and participate with other people will get their brain moving, will, in some circumstances, get their body moving. And if schedule permitting, you might even attend some of those, encourage them to go. So it's less about trying to twist their arm to do some activity. If they're, unhappy or depressed or don't have the energy, don't feel like they have the energy for it, that you participate and get involved when you're able to will help encourage them to get involved. And just a side note on that, depression is very normal. Statistically, it's diagnosed a lot in older age, and I see a lot of folks in nursing home resident charts when I go through cases after the fact where they're diagnosing and even treating with pharmaceuticals for depression. And yet, if you look at their activity logs, these folks aren't getting involved in things that'll help get their dopamine going, get their activity and blood flow going, and might help them sometimes maybe even more or in combination with those pharmaceuticals. So it really is helpful to help them overcome whatever internal resistance they might have. And number 5, try to get the family involved. And what do I mean by that? I often am contacted by people who have a primary caretaker role. So maybe they were, they had a parent or a loved one living with them beforehand. They kind of took a leadership role in that. And then that continues in a nursing home or assisted living setting. And sometimes it's easy to feel like, well, I'm the only one doing this. I'm doing most of it, and not realize that you have a depth of experience and knowledge from that prior experience that your family, siblings, kids, your parent or loved one's grandkids may just not have, and they may not feel that comfortable. So for them, visiting might mean going and sitting down next to the bed and feeling uncomfortable or not feeling like they know what to do. So to the extent you can, go ahead and try to get those folks involved. Try to set up sessions, encourage them to attend activities, let them know what the schedule of activities in the facility are. And they might find that it's a lot easier to get involved when there's some kind of plan, whether it's bingo or playing cards or music listening or something like that. So you can help them help you and help your loved one by encouraging them and enabling them to be able to feel confident about that. I know this isn't easy. It may not be possible, schedule permitting, but these are some ideas you can take into account in how you set up your schedule and see if it can't help you find more ways to get a loved one up and about. And don't just wait for the nursing home to do it. Don't just complain and say, this is what they're supposed to do. You're right, but nursing homes are, in my experience, at least the ones I have to deal with, unfortunately, are understaffed. Their nursing and aide staff are stretched thin, and getting someone up and about and to an activity is not always top priority when they're triaging residents with a lot of care needs where catastrophic things will happen, as opposed to a slow decline if they're not activated. So don't wait for them to do it. Definitely make those complaints or make those requests, but if you can, schedule and energy permitting, try to take some of that on yourself. And hopefully that will help keep your loved one healthy in a nursing home. I'm Ohio Nursing Home Abuse and Neglect Lawyer Will Eadie. Please like, comment, share. I'd love your comments. What is your experience? What have you find helpful? And that can help others. Thanks so much.